You're live. All right, good morning. This is Senate Health and Welfare. It is Friday, April 10th. And we're looking at a bill, I think that we've all been interested in hearing about for a bit, H 577, the prescription drug discount program. Is Wendy is here. Thank you. So the reporter of the bill from the House, come on up. Yeah.
Thanks for having me. Wendy Critchlow from Colchester, Chittenden 19th was up there. I bring to you 577, which is the prescription drug plan that came to us from the treasurer's office, and we love this bill upstairs, and I think you will too. As we all know, it'll sing into the choir here, but healthcare has become increasingly out of control. This is something that has been brought to us to help us at least rein in some of the prescription drug prices that wrapped everybody. We can and we must do more to rein in the cost of prescription drugs for our constituents, and 577 plans to do that. It would authorize the Office of the State Treasurer to join a growing multi-state coalition known as ArrayRx, a collaboration founded in 2006 by Washington and Oregon, that has since expanded to include Nevada, Arizona, Ohio, and most recently Connecticut. Joining ArrayRx would allow Vermonters to participate in its prescription drug discount card program, making lower prescription drug prices available at the pharmacy counters. So what would this mean for Vermonters? Any Vermont resident can participate in this prescription drug discount card program, making lower prescription drug prices available at the pharmacy counter. Any Vermont resident can sign up. The card offers discount prices to all prescription prices approved by the U.S. Food and Drug Administration, with savings up to 80% on generic drugs and up to 20% on brand name medications, as well as discounts on certain over-the-counter products. These savings would be especially meaningful for residents without insurance and for those who face high out-of-pocket costs on prescription drugs. Unfortunately, as the Affordable Care Act subsidies and federal tax credits expire and Medicare plans become less available, a growing number of Vermonters, especially seniors and working families, find themselves needing additional help to afford their medications. Even for Vermonters with good insurance, the ArrayRx may provide savings in certain cases. In addition, expenses incurred through the card can count towards the patient's deductible. That was part of what we worked on. They just have to submit it. And we found out from Blue Cross Blue Shield that you just go online and submit your receipt. So it's easier than we thought it was going to be. In Connecticut, which joined the program in 2023, residents have seen an average savings of approximately $250 a month, $259 a month. If just 1% of Vermonters enrolled and experienced similar average monthly savings, Vermont households could collectively save more than $20 million each year on prescription medications. This is money families could instead put towards necessities like food, electricity, gas, or savings for the future. As we can bring this program to Vermonters without any ongoing cost to the state, the program is self-funded through a small transaction fee baked into the advertised price that a consumer pays when they buy a drug. This legislation has received enthusiastic support from the Vermont Medical Society, Blue Cross Blue Shield Vermont, the AARP, the Office of the Healthcare Advocate, a notable independent pharmacist, and the Oregon State Pharmacists Association. And unlike other discount drug prices and commercial insurance companies, the ArrayRx discount card is governed by public sector employees who are dedicated to balancing the needs of pharmacies and consumers. I think this is like, as far as like what we did last with the AI and the data sharing and stuff like that. This is a great alternative. It really is. And after hearing extensive testimony from the healthcare committee, voted in favor of H 577-1100, and it passed unanimously at the floor. And we hope you'll take it up because it's great.
We are taking it out
Okay.
right now.
Thank you.
No, thank you. And that your information that you provided is really helpful, right on target. Thank you.
Thank you.
Good. Questions for Representative Critchlow?
I think this one, and maybe I missed it in what you just said and apologize. I'm trying to understand how the savings are achieved. How does the drug company actually be able to, because I have the card,
Yeah,
provide the drug at a lower cost? How? Well,
it's so it's like if you used any other drug discount card, you go in and you purchase the card, it's bought in bulk, like, so it's anything kind of consortium with a drug discount card. So it works like any other discount card, only this is not like GoodRx or if there's other discount cards.
So we'll probably get to answer your questions as we talk with
okay.
folks on that one. It might be more complicated.
It is complicated, but it's working. Yeah, pharmacy is complicated.
It totally is.
I'm still learning about PBM.
Oh my God.
That's complicated.
I'm gonna have to pull up my
By
diary.
design.
By design, yeah.
Thank you very
My
much,
pleasure.
Representative Critchlow.
Thank
Good
you.
to have you in the room.
Thanks for having me.
All right,
Thank you.
Janet, come on up. Yep.
Good morning, Jen Carvey from the Office of Legislative Counsel. We will put the language up on the screen and we'll walk through it. Great. So this is H 577, an act relating to establishing the Vermont Prescription Drug Discount Card Program. And it creates a new subchapter in 18 VSA Chapter 91, which is the Prescription Drug Cost Containment chapter. This subchapter is on the Vermont Prescription Drug Discount Card Program, and it then starts by establishing the Vermont Prescription Drug Discount Card Program, administered by the Office of the State Treasurer, who you'll hear from next, for the purpose of pooling prescription drug purchasing power with other U.S. states and territories and non-governmental organizations. So that's sort of the short answer, is that it's kind of doing volume discounting based on pooling purchasing power. It specifies that the program would be made available to all Vermont residents. And then as far as furthering the purposes of the program, it allows the treasurer to cooperate with other U.S. states and territories, regional consortia, other or non-governmental organizations, or a combination, to pool prescription drug purchasing power to reduce prescription drug costs, negotiate discounts with drug manufacturers, centralize prescription drug purchasing, and establish volume discount contracting. And then it defines volume discount contracting as the negotiated purchase of a large quantity of a prescription drug at a decreased cost. It directs that any monies received by the program from transfers, gifts, grants, donations, or any other source, including monies provided to the state through a cooperative arrangement authorized by this section, and you'll hear, I think, more about the money flow from the treasurer's office, would be deposited into an existing special fund, the Financial Literacy and Economic Empowerment Trust Fund, and available to the Office of the State Treasurer to defray costs associated with administering the program. And we'll look more at that fund in a moment. I just want to stop here to say there was a new special fund created in the bill as introduced. There in the House Ways and Means Committee, they were not in favor of creating a new special fund. They wanted to use an existing special fund. So we had some language added that expanded the allowable usage of an existing special fund in order to make that work. So that's why we've got the money going into this particular fund. And the monies deposited into that fund from all of these sources would be available to the treasurer's office to defray costs associated with administering the program. You'll see some more language on this in a moment, and Representative Critchlow mentioned it, but the amount paid for a prescription drug after using the discount card by an individual who's covered by a health insurance plan must be attributed toward the covered person's deductible and out-of-pocket responsibilities in accordance with statutory language that you will see in future sections. So this is allowing, even if they use their discount card, instead of going through insurance, those amounts would still get counted toward their deductible and out-of-pocket responsibilities under their insurance plan. Then there's an annual reporting requirement starting January 15th, 2028, and annually thereafter. The treasurer would submit a report to the House Healthcare and this committee and the governor detailing the activities of the program during the previous calendar year, including how many Vermont residents and pharmacies participated and what amount of savings on prescription drug costs was achieved. Sections 2 and 3 are dealing with this application of the amounts spent out of pocket toward deductibles and out of pocket maximums. The first is amending APSA section 4093, which is in our health insurance statutes. And under existing law, the existing law prohibits a health insurer or pharmacy benefit manager from excluding any amounts paid by or on behalf of a covered individual, including any third-party payment, financial discount, coupon, or other reduction when calculating how much that person has contributed toward their out-of-pocket limits for prescription drugs, out-of-pocket deductible, and out-of-pocket maximums.
So maybe it's a good idea to go through this one a little bit slower.
Yeah, so I'm just telling you what the existing law is, so I could tell you what the bill
Okay.
adds. Yep, so this bill adds specifically discount card. And so there's no confusion about whether that is included in discount under existing law. So this would prohibit the health insurer or pharmacy benefit manager from excluding any amount paid by or on behalf of a covered individual, including using this drug discount card, regardless of whether the individual purchased the drug with or without using coverage for the drug under any health insurance plan. So this is part of some language, making sure that the amounts spent out of pocket by the individual using this drug discount card instead of their insurance would still get counted toward what they have to pay before their insurance kicks in, and toward their out-of-pocket maximums. And then this doesn't make any changes to the existing exceptions to that provision. There are some fairly large exceptions to that existing language. And for ease of reference, this provision is often referred to as the copay accumulator. So this allows everything that somebody spent out of pocket for prescription drugs to be counted toward their financial responsibility under their plan for prescription drugs. So it kind of accumulates all of their copays. So under existing law, the copay accumulator provisions do not or shall only apply to a prescription drug if there's no generic, or this language refers to generic biologics. So only drugs for which there is no generic, or there is a generic, but the covered individual has gotten authorization under their insurance plan to have that drug anyway. And then we have our existing carve out, no changes to this either, that the provisions of this copay accumulator only apply to a high deductible health plan only to the extent it doesn't cause problems under federal law. So then there's new language saying in order to facilitate the appropriate attribution of amounts paid by or on behalf of a covered individual for someone who is buying their drug without using their drug coverage. So this is particularly comes up with this new prescription drug discount card. The health insurer or pharmacy benefit manager or both must make readily available on their website a downloadable proof of payment form for the covered individual to use to submit proof of the actual amount that they paid for the drug, and provide notice to all covered individuals at least annually that they are responsible for providing the proof of payment using that downloadable proof of payment form or another mechanism if the insurer or pharmacy benefit manager chooses to make another mechanism available, like the online one, a form that you heard about from Representative Critchlow, that American Blue Cross makes available, in order to have their spending properly attributed to their out-of-pocket limits, deductible, and out-of-pocket maximum. So there's a lot here. I'm going to pause for a moment. But again, the concept of this section, and it's repeated in the pharmacy benefit manager statute in section 3, is making sure that somebody who uses their prescription drug discount card, instead of using their insurance benefit to buy the prescription drug at the pharmacy, still gets to count the amount that they paid out of their pocket for that drug, gets to count that toward their deductible and their out-of-pocket limits under their plan. But there is some responsibility on the purchaser to prove that amount to their insurance company. Does this make sense?
It does.
Generally.
Was there any talk that that was going to be a barrier for some people?
I think that is why there is language requiring, I think not specifically, but I think the option of the downloadable proof payment form or another mechanism. And I think some of this is already happening with other discount cards and coupons. So the insurers can probably tell you about their process, and I'm sure we'll hear from the healthcare office as well. So section 3, as I mentioned, really does the same kinds of provisions for pharmacy benefit managers in their statute. There's existing law saying that a pharmacy benefit manager, PBM, shall not require a covered person who's buying a prescription drug to pay an amount greater than the lesser of, so they can't be required to pay more than the lesser of the cost sharing amount under their plan, the maximum allowable cost for the drug, or the amount the covered person would pay for the drug if they, after application of any known discounts, if they were paying the cash price. So there are some additional provisions in here. A little bit. One is just taking out what I think is sort of an unnecessary broad filters that created some confusion with the existing law. But when we're looking at the amount the covered person would pay for the drug if they were paying cash, this is clarifying that that is if they were to pay the pharmacy's usual and customary cash price. So that's what we mean by cash price. Instead of using the drug benefit, and then it's making it clear that we're not talking about a prescription drug discount card program, a discount card or other third-party prescription drug benefit program. So what does this mean? This means there's a lot of talk upstairs about whether the intent of this limit on what the PBM can require the covered person to pay out of their pocket means that the PBM has to match the drug discount card price if that is, if the person has the drug discount card. That was not the intent. So if the person wants to use their drug discount card because that's the cheapest, they can do that. They can still count it for their copay accumulator, but they can't force the PBM to charge them that price. They can't run it through their insurance and force the hand of insurance. The net result, I believe, should be the same for the patient, that they're not at any disadvantage. Then we have that same language that was in the previous section about the copay accumulator and the PBM making a downloadable proof of payment form available, providing notice to covered individuals at least annually, and the potential that they may have another mechanism as well. Section 3A, now we get back to the special fund. So this was the language that was added in House Ways and Means. It's expanding the uses of an existing special fund. Currently, it's the Financial Literacy Trust Fund in 32 VSA 111. This adds economic empowerment, which is a division within the Treasurer's Office. So there's some consistency there. This, to some extent, just updates existing language. We didn't need to establish and create a special fund, so we're just establishing a special fund, expanding the name, making the purposes plural. And so under existing law, the purpose of the fund is to promote the adoption of fiscally sound money management practices by Vermonters through education and outreach efforts, and creating opportunities to build and encourage development of new financial literacy activities and educational products. This is not changing that. It's just adding and to support other economic empowerment opportunities for Vermonters. And then it talks more specifically about the drug discount card program below. So it allows the fund to receive, and this is again, some updates after talking to JFO. We don't appropriate to our funds, we transfer. So the fund may receive transfers and as well as other sources, to the fund. Monies in the fund may be expended in accordance with the trust fund provisions. That's just moving this reference up from lines 18 and 19. Trust fund provisions of section 462 of Title 32. For such financial literacy projects as the treasurer may direct, and it adds and to defray costs associated with administering the Vermont Prescription Drug Discount Program. Or discount card program established pursuant to that other section, section 1, and then remaining language about the fund. Section 4 is an implementation report. By January 15th of 2027, the treasurer would report to the General Assembly on implementation of the program as of that date, including any recommendations for improving administration of the program and an estimate of the projected cost to the state in the event additional financial support is determined to be necessary to administer the program. Section 5 appropriates $50,000 from the general fund to the treasurer's office in fiscal year 2027 for the cost of developing and implementing the program. This appropriation did survive the appropriations committee. I believe Alderman Nolan, but I believe the $50,000 is included in the House passed budget, but they didn't pull it out and put it in there. They left it in this bill. And finally, the act will take effect on July 1st.
Okay. So in simple terms,
So in simple terms, this creates another opportunity for Vermonters to purchase prescription drugs at a discounted cost. And you will hear more from the treasurer's office about how that works, and I'm sure from others about potential impacts and
oh, it works for them.
implementation.
Good. Thank you.
Yes.
Question for Jen before you head out. Any question? Okay, I'm sure we'll, as we go along, we'll have some more for you. Thanks. Okay, so, Nolan, did you want to speak to this now?
I'll be really quick.
Okay, that would be
Really,
great.
really quick. I'm gonna leave all the gore details to the
To the treasurer,
treasurer.
the assistant treasurer.
I don't want to steal their thunder.
Oh, to
They
the-
put on a good show. Rona, I appreciate it. For the record, Nolan and I will join this office. I'm just gonna say real quick, two things that Jen said. I'm just gonna reiterate. One is the bill doesn't create a special fund. It just puts the money into the existing fund and then renames it. We call it the Financial Literacy Trust Fund, and sorry, it's currently called the Financial Literacy Trust Fund. It would change to the Financial Literacy and Economic Empowerment Trust Fund. And that funds would be available to defray the cost associated with the posting of the program. And then the bill would appropriate $50,000 from the general fund to the treasurer, the cost of developing and implementing the program. In terms of details, I will defer to the expert.
Yield,
Will yield
yield.
the members from the treasurer.
All right, thank you. That's good. And I know it's in the budget and the House left it in.
Accounted for in the budget.
So we've got it. So we have, Peter Cromley here.
I'll say a few words at the
Who's
beginning.
coming up
We're-
first?
If you don't mind, we'll both.
Oh, it'd bring me great. Bring the
Okay.
chair up. This is
Thank
great,
you.
yeah. Do you know everyone around the table?
I believe we've.
Okay, great.
Yeah. For the record, David Scher, Deputy Treasurer, and Peter Cromley, Director of Legislative Affairs. I believe I'm there.
All right. Thank you. Why don't you just go right ahead? We've got a terrific PowerPoint.
Great, thank you very much. I'll say a few words to start it off and then turn it over to Peter to dive into the details of the program. This is a top priority for the treasurer in the House. He presented this plan personally. As I think folks know, his father passed recently. He's with his family at this time, so he's not able to do that here. But he wanted me to be here to convey the importance of this to him and
You know, and we want to convey our thanks to him for doing this work and our sincere understanding of why he isn't here.
thank you.
I'm very sorry about that.
As folks know, as this committee knows very well, healthcare costs are an enormous challenge in Vermont right now. So that's the problem that we're trying to address. And we'll tell you a little bit about what this proposes to do to ameliorate that problem. Got the statistics, which again, I'm sure the committee has heard, but they are distressing. Vermonters paid $1 of every $5 earned on healthcare costs. Prescription drugs are a major driver of that number. Prescription drug costs and premiums rose by up to 27% for some Vermonters from 24 to 25. We see rising healthcare costs squeezing household budgets and contributing to inflation. In 2024, Americans spent $98 billion out of pocket on prescription drugs, which is up to 25% over the last 5 years. And as folks know in Vermont, these costs are a particularly acute problem that ends up impacting many sectors across the state. So what will this do to help? ArrayRx cards we would estimate based on data that comes from the savings that people are seeing in Connecticut, so real world on the ground results. Vermonters are estimated to save $20 million a year on pharmacy costs if only 1% of Vermonters take up this card. On average, Connecticut residents who are using this card are seeing savings of over $250 per month on their prescription drug costs. So this is dramatic savings, really impactful for the people who are able to take advantage of it, and something that we want to be able to deliver here in Vermont. And I will turn it over to Peter to talk a bit more about how this will all work.
Yeah, so what is ArrayRx? Representative Critchlow mentioned it briefly before, but ArrayRx was formerly known, I think, as the Western State Public Health Cooperative, something along those lines. It's a partnership that's been going on for over 20 years, for much of that simply between Oregon and Washington, two states that were collaborating very closely with the intent of helping people save money on prescription drug costs. And since 2023, it's been expanding to other states across the country: Arizona, Nevada, Ohio recently joined, although they don't, I believe, participate in this particular program as of yet, and Connecticut. And the basic theory behind this collaborative is that when states sort of pool their resources, pool their market power, and collaborate on the administration of programs, that can be for the benefit of all those states' constituencies. ArrayRx operates a wide variety of programs, but the one we're proposing to join here is the prescription drug discount card. A few key features of this discount card that were really important to us as we weighed this proposal. One, there's no cost to Vermonters. We'll talk a little bit more about how the program is funded, but there's no membership fee to have the card. There's no enrollment fee. You pay when you want to get the card. And there's no hidden fees levied against you or the pharmacy in the transaction or after the transaction. There's rather broad coverage that this card has. All FDA approved prescription drugs and a number of over-the-counter items have a discount on this card. That discount varies drug to drug, and it varies point of sale to point of sales. But across the board, you see really strong savings, up to 20% on brand name medications, up to 80% on generic medications. And it's usable at over 65,000 pharmacies nationwide, including the majority of pharmacies here in Vermont. If you are a Connecticut resident or an Oregon resident, you have an ArrayRx card, you're visiting Vermont on vacation, you can use it at a pharmacy in this state. But who can't use it? Vermonters. And we'd like to change that. There are rather transparent pools that come with the program. We'll show you how those work, but you can look up the price of any drug at any pharmacy that participates ahead of time. So you can evaluate where to get the best price for yourself and what savings you might achieve. It's a privacy first model, so no data is sold to data brokers. There are private sector discount cards, and part of their business model has always been collecting their data and either selling it directly or passing it on to a parent company that sells that data. And we have a great concern with that when we're talking about health data. It provides a lot of flexible support regardless of your insurance circumstances. You can sign up for this card once and have it for the rest of your life. And if you have a period of gap of coverage or you're changing insurance or whatever your other circumstances may change, it'll remain available to you as an option. And it was important in proposing this that we felt like it had a pharmacy-friendly price structure, especially compared to some of the private sector alternatives with their profit motives. This is a public sector benefit. It's administered by public sector employees across a variety of states that are doing their best to balance the needs of various constituencies, consumers, and pharmacies. How does the program administration work? ArrayRx, the consortium, handles the majority of the administration. That's what makes it such an affordable option for the states. They negotiate the contract with the pharmacy benefit managers and with pharmacies nationwide. They operate customer service emails and phone lines. They administrate the card. They're the ones who actually send you the card and determine your eligibility. They maintain IT and data security. What would the treasurer's office be responsible for? Largely driving utilization of the card, making sure that Vermonters are aware of it, making sure that we're building the partnerships needed for it to be a known option for our constituents. I'll add, a degree of constituent services. Folks will associate the card, with our office if they're aware that it was our proposal, and they may reach out to us, and we'll be responsible for making sure they get to the proper folks at ArrayRx who can deal with any issues. Yes.
Peter, thank you, Madam Chair. So you were saying they a lot. If the they are the people working for ArrayRx.
Yeah, I appreciate you asking that question. ArrayRx is not its own legal entity. It's just this name for this collaborative. So when I say they, these are staff at the Oregon Public Health Authority that administer this program for all participating states. And our office will be responsible for participating in the steering committee, which is the governing body made up of representatives of all the states that participate. They oversee the pharmacy benefit manager company that is involved in this program. They oversee the budget for the program. They're looking out for their state's interests and the public interest and the administration of the program. So it really is a collaboration of states staffed by public sector employees out in Oregon.
Go ahead.
So if Oregon is administering this, then more states that obviously join, the more workload that puts on them. How are they being reimbursed or covering the cost for the administration of the program?
That's a great question, which leads us right to this slide right here. So when you pay for a drug using an ArrayRx discount card, baked into the advertised price that you can see online and that you see at the counter, baked into that price is a small fee. That fee is remitted up to ArrayRx like a provider tax or the sales tax, although in this case included in the price. And that fee goes to cover the operating cost of the consortium, which is in large part the sort of portion of those public sector employee salaries that is needed to cover the portion of their work dedicated to this program. There's a budget for the program that is set by the entire steering committee. So we would have a role in setting and managing that budget. And it's designed to operate, as lean as possible. So there isn't a lot of excess revenue that comes after you pay for the operating budget for the year. But any money that is left over from the year is redistributed back down to the states proportionally to what percentage of fee revenue they sent up. So if Vermont users make up 5% of users in the country, we'll get 5% of the leftover revenue back to the state. And we can use that for marketing the program for our needs and running the program in the state. That's a very small amount of revenue because the operating budget is kept, the fees are kept as lean as possible to just barely cover the operating budget. Something on the order of probably hundreds in the first few years to a few $1,000s in a year at most. So it's not really a revenue generator for the state. It's simply trying to cover the cost of the program.
Does it generate revenue for Oregon?
It covers their costs, which are set by the whole steering committee, not just the state of Oregon, but all the state members. Yeah. Are there any questions about how the fee structure works? So how does the card work itself? Well, you visit ArrayRxCard.com. You sign up by entering your name, your date of birth, and a valid Vermont address, and then the card can be delivered to you instantaneously by email or by mail if you don't use email. It really is a quick process. You can drive up to a pharmacy and think to yourself, oh, I've heard about this new discount card, and pull it up on your phone and get it right then and there and then use it at the counter. And all you need to be able to sign up is a valid Vermont address. How can you use the tool? So there's 2 tools available online, one to find pricing for your drugs, one to find which pharmacies participate. This is what the sort of drug finder tool looks like. So I'm looking to purchase ataraxate calcium, 20 milligrams. So I enter that drug. I want a 30-day supply. And I can see all the list of pharmacies near my zip code that accept the ArrayRx discount card. You see them all as the little black dots. And let's say I live in Essex Junction, and I typically go to this Kenny Drugs, and I can see that this drug will cost me $7.08 at Kenny Drugs. If I'm, Walgreens member, maybe I'm willing to pay the extra 20 cents to not have to change pharmacies. But you can easily see where you can buy the drug and at what price you can buy the drug. This is from ArrayRx's presentation to us. It includes some sample drug prices. So the average cash price for these drugs. In the third column, you can see the ArrayRx price on average for a 30-day supply and the ArrayRx price for a 90-day supply. And you can see, pretty clearly there's some major savings. Ataraxate, which I believe is a commonly used cholesterol medication, with ArrayRx, you can get a 90-day supply for less than it would cost you to get a 30-day supply if you're paying the cash price of that drug. So who does the ArrayRx discount card really benefit? Well, anybody might benefit from the card. Savings will depend on what, if any, insurance you have, what particular drug you're trying to buy, and where you're trying to buy it. So there may be circumstances that anyone could benefit from the card. But there are a few groups that we think are particularly of benefit. And I'll note, when we introduced this bill, payments you made for the card were not going to count towards your deductible. That is something that other states had not done yet, although Connecticut's doing this year. And the House Committee on Healthcare wanted to make that change, and they were able to make that change, as Jen walked you through. And I think that's a great benefit for the bill, because it makes this an easier choice to use if it provides a discount over and above what your insurance offers. So who are the groups that will particularly benefit? Uninsured Vermonters, those who lack any kind of health coverage and have to pay entirely out of pocket. It's about 3% of Vermont residents, although that uninsured rate is significantly higher in certain counties, including the Northeast Kingdom, Memorial, Essex County, for example, has an uninsurance rate of 8%. Underinsured Vermonters, those who have really high out-of-pocket costs or high deductibles, they're very exposed to prescription drug prices. That's a much higher number, about 31% of Vermont residents aged 84 and younger. Sorry, 64 and younger. Seniors without pharmacy coverage. When we were examining this proposal late last year, we were watching what I'm sure you all were, a real contraction in the Medicare Advantage market in this state. And we were very concerned that a lot of seniors navigating that transition might end up without Part D coverage. 8 to 10% of nationally of seniors don't have any sort of drug coverage whatsoever. And those are, of course, that's the population that uses prescription drugs most regularly. And if your insurance does not cover a specific drug, in particular, one of the things that Connecticut pointed out to us when we were looking at the program is the class of drugs where they see the highest dollar amount of savings for their residents are GLP-1 drugs for weight loss, which insurance companies are increasingly not covering for weight loss uses. So I want to walk you through a couple of examples, hypothetical examples of certain constituents and how they might benefit. So here we have Mary Smith, the relatively young Vermonter with a really high deductible bronze plan. She has to pay really high out-of-pocket costs for her drugs, and she takes sertraline and Adderall on a monthly basis. Her savings under ArrayRx, and these are hypothetical prices that she might pay through her plan, and then the ArrayRx drug price at a pharmacy, she would save about $153 per month filling these prescription drugs. This is Jane Doe. She's an older Vermonter. She takes 3 very common medications. She has no pharmacy coverage, so she seeks out the most affordable generic medications that she can find for her conditions, for high cholesterol, blood pressure, and her diabetes. And even though she's already buying relatively affordable drugs, she's going to see pretty significant cost savings, $90 a month. And here's Fred Collier. Fred wants to use a GLP-1 for weight loss. Maybe it was covered by his insurance last year and it's not covered by insurance this year. We would like to continue using it, but it's simply not affordable at the retail price of $1,000 a month. Their ARX price, it's still, you know, a good amount of money a month, but it's an $820 savings for him. So it, you know, might take that drug, depending on his income, from completely unattainable to within reach for his use. A little bit about the legislative path of this bill today. Representative Critchlow mentioned it was passed out of House Healthcare 11-0, Ways and Means 9-2, and Appropriations 8-2 with one absent, and then had a favorable voice vote on the floor. Hopeless Ways and Means. Hopeless Ways and Means. Well, thank you for pointing that out, Senator. Our good friends at Hopeless give good care to the bill. And if you want more information or can correct other typos, you can reach me my email here number, as well as Deputy Treasurer Scher here today, or we're happy to answer any questions you have now.
Go ahead, Senator.
So you're getting a lot of, this company is going to be getting a lot of consumer data.
Mhm.
How is that going to be protected?
So the data, the IT and security is managed by the consortium staff out in Oregon, as I understand it. There is anonymized data collected for the state's use only, so that they can see what the savings the residents are achieving and, you know, trends in drug purchases. All that data is.
Yeah, I'm not worried about that side. I'm worried about customer data.
Yeah.
Because they're going to know on that card every single drug
Mhm.
that those individuals are taking.
Mhm.
What's it called? The name of the company.
So the pharmacy benefit manager is called Navitus. The RareX is the name of the state collaborative.
Okay.
So only those states in the collaborative have a right to access and use.
Can they
that
sell
data.
that data?
Absolutely not.
And your pharmacy right now is selling that data.
Well, that's why.
This state
And
banned it. We lost in court.
Oh, really?
Supreme Court.
Really?
Yeah.
Yeah,
The
the
big Supreme
finance
Court.
committee 20 years ago, at least.
Oh, not that long. Oh, was it 20 years ago?
Yeah. And we did a lot of work on pharmaceuticals, trying to get the price down. And
That was,
We
it
lost.
was huge.
so
effort.
they are selling it to data miners. And
Well, that's
if
my
you
concern.
go
Mhm.
buy, I had a friend whose doctor put him on blood thinner. Because they were trying out different things to see what worked. He said he filled that prescription. And before he knew it, he got a call from the online pharmacy saying, we can get it for you soon. Or cheaper.
Well, and here, it's what won't happen, that won't happen with this, because it will be protected information.
Yes.
And, but other drug companies not in this program are able to collect the data.
Yeah.
And sell it. Detailing, it's called, and they can detail it, and then,
We banned.
I did talk with a group of folks with disabilities, including MS, some folks with MS. And they were being taken to lunch and they were being sold new drugs. That won't happen.
And the doctor would get a call saying, we just came in and bought your entire office lunch or took you out to dinner. And we told you all about our new approved purple pill was the
Well,
the new approved purple pill. And your prescriptions for that purple pill, or there aren't any more prescriptions coming out of your area for the purple pill. So why aren't you prescribed? Or they'd leave you samples and you give those to people, and then the people would want to refill. The new and improved purple pill, which had a time release capsule in it. So it was cheaper if you took 2 of the old purple pill without the time release. And if there is evil, it's pharmaceutical companies.
There's good and evil.
So that
That's-
data selling would not be allowed under the program. The states would have an access to their state data only, so Arizona wouldn't be able to look at the anonymized Vermont data. But
And we know what, I've
Senator
got to
Drew
look
had a
up
question.
Canada's online pharmacy and see. If it, is better here.
Curious about what the plan, I mean, the power of this program will be the number of people who actually opt in. So what's the treasurer's plan to get the word out and make sure that Vermonters are signing up? Or are you working on that?
So appreciate that question. That is the reason we asked for a $50,000 appropriation. We would like to do paid media outreach. You know, we've stood up a couple programs in recent years. Vermont Saves, particular via for unclaimed property. We do a lot of marketing for that program. So we do have some experience in marketing these programs, trying to drive awareness for Vermonters. We've also talked with the AARP, Blue Cross Blue Shield, the Medical Society, all of whom have indicated an interest in partnering with us to spread awareness of this card. So we'll be relying on partners as well.
Well, you have to, yeah.
In that same vein, is there a benefit to pharmacies to actually have people sign up for this card?
I'd say there's a benefit in pharmacies versus some of the private sector alternatives like GoodRx, private sector discount cards that have more predatory fee practices.
Whether they could be an advocate for some of the people that come to their pharmacy to sign up.
Well, there are certain, definitely we have letters I can share from 2 pharmacists in particular across the state who express support for this program because they want it to be available to their customers for affordability.
You're saying March.
Is there, so the savings, it's not just at the manufacturer's level, is it? Because I understand there's people in between the manufacturer and the pharmacist lots of time that are moving these drugs through the
PBMs.
pipeline. What they know.
Pharmacy benefit managers,
Okay.
PBMs.
And so I think that they were causing a lot of the cost of pharmacy, to pharmaceutical drugs too. So is this going directly from the negotiation from the manufacturer to this company, and there's no middle people in between?
Yeah, so the pharmacy benefit management company that ArrayRx contracts with, you know, ArrayRx has a variety of programs and now a variety of states. That's a pretty significant market leverage and to you that they bring to the table when negotiating with Navitus, this pharmacy benefit manager, and this pharmacy benefit manager negotiates this sort of ArrayRx drug price. So it's using the market leverage that they have to offer Charlie Becker put it in the House, a different menu of pricing options that are available to ArrayRx.
Okay, so you're not negotiating then directly with the manufacturer.
The states will not be direct.
Right. Okay. Might even get it cheaper that way.
Other questions? So what are the biggest barriers that you're running into in terms of either, getting the bill moved forward, because we're working together on that? Any thoughts you have there? We're gonna have folks in to testify. Sounds like there's a lot of support for the bill, which is a good thing. And anything else we should hear?
So we have, one of the biggest things that made this bill take a little more time in the House was the appropriation. So we were very grateful to the Appropriations Committee for keeping the language in the bill.
I know someone on appropriations who might support this. Yeah.
Hopefully you all have some friends in that kind of hall. There were a few different perspectives shared on the bill from certain small business pharmacists, independent pharmacists. Like I mentioned before, we had a couple of independent pharmacists write letters of support for the bill, and I'm sure they'd be happy to speak with you all on this committee. There were some independent pharmacists who expressed concern about the bill, because on some drugs, in some transactions, it will reduce their margins. The reason we like this as an alternative to the private sector discount cards out there is the private sector discount cards want to offer the most aggressive pricing to maximize their user base, which can mean the most aggressive losses for a pharmacy. This discount card, governed by public sector authorities, is more interested in fairly balancing those constituencies' needs. When we've talked to pharmacy associations like the Oregon State Pharmacy Association, that their members have been operating this card for over 20 years, and they had no concerns. And indeed, the executive director of the Oregon Pharmacy Association wrote a letter of support we can also share with you as well, in favor of the bill. The reason they point to as why this card has worked and the private sector alternatives don't work for their pharmacy members is this public governance structure, where if a pharmacy or group of pharmacies have a serious substantive ongoing concern with the card, they can reach out to the public sector authority in Oregon that is overseeing the card and have their issues be addressed, because they are constituents of that authority in ways where they're not constituents of a private company. So that is the key benefit that the public sector governance and the balancing of constituency needs that pharmacists in other states that have used this card for many, many years, that's what they point to and say it's why it works for us.
Medicaid system, does it?
There is an ArrayRx consortium program that for Medicaid, like I mentioned at the top, they have a couple different programs. This discount card is just one. We're not proposing to enroll the state in that Medicaid program. That would probably be a more appropriate initiative for DUIT to undertake than versus our office. But different public authorities in a given state can be the participating entity in different ArrayRx programs.
Other questions for the treasurer's office? Good. Thank you for your work on this and bringing it to us. And we know where to get some of our basic answers for this. This is really great. Thank you.
And I can just check it out online and check drug prices.
Absolutely. Yeah. Searching drug prices online.
When does this bill go into effect? Is it
July. It's really going to July 1st.
July 1st? How long does it take for you to really get the word out, get it going?
Well, the first step would be to actually go through the contracting process.
Yeah.
For ArrayRx, which, we learned from when we did medical debt relief last year. Sometimes that contracting process can take a little while. We want to move it as quickly as possible. Our hope would be to be able to launch the program by the end of this year or very, very early next year. Once we've completed the.
So we're looking sort of at January or, yeah.
But even before we finish contracting, we'll get right to work thinking about what our outreach strategy is, communicating with partners like Blue Cross and AARP about what their outreach strategy is, make sure we're not duplicating our efforts and do the best to reach as many people as possible. When Connecticut passed this program, they did not put any money into marketing. And they saw like less than 1% uptake. So they're going back this year and appropriating more money for this program. It was the number one lesson learned from Connecticut that they urged us to handle differently.
Not invest some money up front.
A little bit upfront, 50,000, and we think 1% of Vermonters sign up and see Connecticut saving rates, 20 million a year save the prescription drugs.
Okay.
Thank
Thank you.
you for your time.
Thank you for your work on this. Appreciate it.
People need that money. That's
All right. So we're gonna shift gears in just a minute. The next topic is not a bill topic, but it's something that we have looked at a little bit in here before. The S-194, the conflict-free case management issue. And what I'm going to suggest is we take a short break right now. And we're going to have the DAs and Dale, and we're talking about some language in the budget that is relevant to our committee and that I've been working on to make recommendations to the appropriations committee on the language itself. And I thought it would be instructive and helpful for all of you to be engaged in thinking about that language. And so it is really asking overall, it is to have an evaluation and assessment of the contractual relationships between our designated agencies and the Agency of Human Services, and then how that language plays out. I've met both with Dale and also with the designated agencies, Vermont Care Partners. And so they're just trying to pull that together. And so we're going to take a short break, go offline, and then we're going to come back and we'll have an interesting conversation.